I hope you're doing well. Today we are going to look at home accidents in children. As children move in the compound and at home, they tend to get accidents. So we are going to look at this following outline: the definition, the risk factors, most common accidents at home, and then how to deal with these accidents. World Health Organization defines an accident as an event independent of human willpower carried out by an external force and acts rapidly and results in bodily or mental damage. It's random, occurs by chance, and is uncontrollable. An injury is an intentional damage to the body due to exposure to an external agent, which can be thermal, chemical, electrical, mechanical energy, or agent. What are the risk factors that expose these children to getting injuries at home? One, poor supervision of the children, family stress like death, chronic illness, or homelessness, parental carelessness or ignorance, living with the elderly who are weak and may not have the energy to supervise children throughout, marital discord like violence at home, gender-based violence, then overcrowding. Many children living within a small area and hence they easily knock onto the walls, knock stones and fall down, and then lack of outdoor play facilities for the children because these are safe environments. So yeah, children can easily play and don't get harmed. And then unfamiliar environment. If these children have gone into this environment, it's new to them. They don't know where is a stone, where is a block. They easily knock onto these blocks and stones and they fall down. Then let's look at what makes children vulnerable to these injuries as compared to an adult. How come these children are more vulnerable to these injuries? One, they don't know how to keep themselves safe. As an adult, you may have the chance to see a stone and you skip it, and then they have small hands, legs, arms, and feet that can be caught up in small gaps and holes. Find in a small hole in a bungalow, in a home, the kid has squeezed his head inside there because the head is small, and then their skin is thin and thus easily bruised. Then they have natural curiosity, they have this impulsiveness and hyperactiveness, thus puts them into harm's way. And then you have drive to test on new master skills. If a child realizes now he can carry a cup, now he can carry a glass, he's attempted to continue carrying this glass and cup wherever he goes and hence ends up falling down in the process. And then desire for peer approval. When they learn that they can carry a cup, now if find they're bringing the cup, mommy, 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 they go and bring another thing, they bring a plate, mommy, 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 they want that approval from you. As a result, sometimes they fall down. Then let's look at what are the most common accidents that occur at home. One is choking. They might swallow something accidentally that chokes them. Then you have suffocation. This suffocation can be in form of swallowing something or something blocking the airway. And then you have strangulation, drowning, burns and scalds. Then poisoning. This can be in form of disinfectants taken in the home, hand wash, gels, and then you can also have glass related injuries. Let's look at one of them, choking. Choking is common in young children who frequently put things in their mouth, and note that they lack the oromotor skills to avoid choking on these items. In addition, their airway diameter is small and more readily occluded than in adolescents and adults. Food is the most common cause of non-fetal choking, followed by toys, as playing with the toys dominates most of the life of infants and children. Then, so how do you manage choking in infants? You lay this infant on your arms or thigh in a head down position. You give 5 blows to the middle of the back of the infant with the heel of your hand, and then if the obstruction persists, you turn the infant over and give 5 chest thrusts with 2 fingers on the lower half of the sternum. If obstruction persists, you check the infant's mouth for any obstruction that can be removed. Let me show you here. So you place the child on your thighs in a downward head position, and then you give 5 blows to the back of the infant with the heel of your hand. This is the heel of your hand. Okay. Then in case it persists, the obstruction persists, you can also turn the child over, and then you place the back on your laps or hand, and you give now, see here, you give chest thrust with the 2 fingers, and then you check the airway and the mouth to remove any obstruction. This is the management for infants. What about children that are 1 year and above? This is what you do. You administer blows to the back to clear the airway obstruction. So even here you give a blow. But then those blows here, the child can be sitting, they can be kneeling or lying. Okay. Now, if the obstruction persists in those children, you go to the back of the child, and then you pass your hand around the child's body. You form a fist with one hand immediately below the child's sternum, and then you place the other hand over the fist, and then you pull upwards into the abdomen, or what you call an abdominal thrust, and do it 5 times. Let me show you here. So this is it. The child may be lying down like this, and then here you're giving 5 blows on the middle of the back, and then, or if it persists, the obstruction persists, you perform an abdominal thrust. We said one hand was forming a fist and is placed in the abdomen below the sternum. Then one other hand is used to hold that fist that has been created, and then you pull backwards to form a fist, to form an abdominal thrust. Okay. So this is still an overview of what we have said. This was in infants, and here we are placing the child in head down position and giving 5 blows in the back, and then here we are doing an abdominal thrust. So what are the investigations that you can do in this child who have come and are presenting with signs of choking? Okay, Of course, after taking your history and doing your physical exam, you can order for some investigation, which include plain chest X-ray. So this chest X-ray may show or may be consistent with atelectasis, pneumothorax, or ear trapping. It may show these features of atelectasis, pneumothorax, and ear trapping. Then also you can order for chest ultrasound scan, and then you can also do specific investigations which include bronchoscopy. This can be used as a diagnostic or as a diagnostic measure, and also it can be a procedure that can be used to remove foreign bodies from the airway. So it can be used as diagnostic and curative. Then also you can do open chest surgery